Hi, everyone. Farmington Mayor Nate Duckett. Thanks for tuning in today's episode of the Mayor's Table. I'm joined by our community stakeholders, and we're going to be talking about vaccinations, registrations, and why it's important for local immunity. Hi, everyone. Farmington Mayor Nate Duckett. Thank you for joining us for another episode of the Mayor's Table. Happy New Year 2021 to everybody out there watching. Today's episode is going to be about vaccinations. It's one of the things that we've been working on now since, 2020. And excited to see this come to fruition, and the plan that New Mexico has rolled out appears to be working very well. And so I have some very special guests that are going to speak with us today about it. First, we have the Chief Medical Officer of San Juan Regional Medical Center, Dr. Bob Underwood. Thanks for joining us.
Thanks for having me on.
Yeah.
Thank you, Mr. Mayor.
Great to have you back.
Yeah.
We have a newcomer today. We have the Emergency Management Coordinator, Allie Rye. She's with the San Juan County Office of Emergency Management. Allie, thanks for being here.
Thanks for having me.
Absolutely. And a friend of the show, of course, we have City of Farmington Fire Chief David Burke. Dave, thanks for coming back.
Thank you, sir.
Yeah. So I thought this would be a good group to talk about maybe some of the logistics of things happening with vaccinations as they're rolling out here in the state. The importance of the vaccination, the difference maybe between what we're seeing between Pfizer, Moderna, and what future vaccinations are coming. And I wanted to just make sure we impress upon the public that they need to get registered for the vaccination. So I kind of wanted to make sure we get all that information out. Hopefully people already know about it, but we want to catch everyone as we can. So let's kind of jump into this. As we look at the United States as a whole in the vaccination process, there's been two vaccines that have rolled out. They're an mRNA vaccine, is that right?
That's correct.
And then New Mexico has received an allotment, a certain amount of those doses, which then they have then distributed amongst the entire state. So Allie, how many doses have actually been allotted to New Mexico?
So New Mexico currently, based on their public dashboard, they've issued a little over 153,000.
Okay.
And so keep in mind that's for the whole state. So coming from Department of Health and the governor, she had to strategically allocate that across the state.
Okay. Of the 153,000, how many have come to San Juan County?
So I can tell you right now, for dose 1, we've received a little over 3,000. For dose 2, we're sitting at 1,000, and we still have about 2,000 left to give. Now, keep in mind, we don't ever know when doses are coming to us. The Department of Health typically calls up whichever site representative they're wanting to send the doses to, and just lets them know, hey, you're getting this amount. Start planning for that.
Well, I guess it's as you need to know type information, but there's a lot of ways in why they would be distributing the certain number to certain states, and then of course the state to certain areas. What are some of those reasons, Dr. Underwood, and how they would determine where best to send those vaccines?
So the CDC has released a priority list of how to distribute and who needs to be on that. It's kind of, we're already kind of through 1A, we're moving into 1B, but there's almost two tiers even within each of those. One is, how do we keep things running? And the other is, how do we make sure we're addressing the people who, if they get COVID, will be more seriously affected by that. So 1A was healthcare workers, frontline, interacting with patients every day, and people over a certain age typically live in a skilled nursing facility because they would be affected more if they got sick. So that's 1A, and then we work our way down, and it's still kind of in that two-tier. The people who are important to keep our systems running and the patients that would be most affected by the disease.
Well, we certainly saw that in regards to individuals in those long-term health care facilities. Early on, Chief Burke, we unfortunately had a couple of our healthcare or long-term care facilities get hit with COVID. We kind of saw the outcome of that. So I'm happy to see that they've been prioritized because, from my experience, at least from what I'm paying attention to, it is individuals, our elderly population and those with underlying health conditions that are ending up hospitalized. And of course, flattening the curve was the goal in order not to overrun our healthcare facility. So making sure those individuals get taken care of, I think, early on is really important. Chief, just in regards to kind of the operation of the city of Farmington side of it, what are some things you're working on in regards to the vaccine within the city organization? I know San Juan Office of Emergency Management is working with the stakeholders, and the city of Farmington is certainly one of those.
Right. And as the doctor referenced, we're doing everything we can to help identify those at-risk populations within the scope established by the CDC, working with the stakeholders, not only associated with vaccine distribution, but as this remains pandemic and difficult for all the organizations to maintain their continuity of operations and staffing. Through Office of Emergency Management, a MAC group or a multi-agency coordination group has been established, and we're actively participating in that on a weekly basis with all the stakeholders and facilitating other needs as they come up through that group, whether it was with the initial evaluation and recommendations to the nursing homes or mutual aid with county, city, or entities within the city, like the detention center, assisting them when they're struggling with testing or other situations up there. So we're part of the greater team just to try and prevent as much interruption in service as possible.
Sure. Well, I know you personally have been intricately involved in this from the very beginning, and the testing situation, and which has been critical, and then now we're moving into the vaccination part of it. Allie, from your department, as we're talking about the 1A and 1B, and I think it's important for people to know that registration is the key. There's certainly questions out there like, how do I get the vaccination or the vaccine? And I think in other states, as Dr. Underwood, you mentioned off air a little bit ago, other states aren't registering people online like we are. So
yeah, we were, as far as I know, we were one of the first states to really kind of roll this out. And when I was talking to other family members or people I've worked with in other states, they were really kind of shocked that we already had a registration process up and running. And so it's been something New Mexico needs to be proud of.
That's great.
Yep.
Allie, and maybe you can kind of lead us through the registration. How do people register? Do you need to be a 1A or 1B? Do you need to even know that to register?
So that's actually a very good point, Mayor. So we are recommending that everyone get registered, and the big reason behind that is that will hopefully influence the governor and the Department of Health for their push to get more vaccines up into this area. So go ahead and get registered. The vaccine site for that is going to be vaccinenm.org. You can go online, get registered. It'll set you all up, whether you're in phase 1A, 1B, or if you're once we get to the community section. It'll go ahead and put you into that slot, and then it will automatically notify you whenever you are ready to get registered when an appointment slot has become open for you. So that way you just log on, accept your appointment spot, go in and get your first shot, and then they'll take care of you for your second shot from there on out. Speaking on that, though, I know that there's a lot of folks within our area that probably don't have access to email or even the internet services as well. So we have, all of us have gotten together and been able to get with City of Farmington's Public Library, and you can go in on certain days and get help through the public library in order to get assistance in signing up, whether that's assistance with gaining an email address or just help walking you through the steps in order to use the website.
I think that's really important. And one of the main reasons why I wanted to even get this video out for folks to see is there's going to be a large population of people who aren't familiar with how to utilize those online services in order to get registered. So making sure that they know that there are resources available to them. The state also has a 1-800 number that you can call. Hopefully it's working correctly, and there were some early issues on it, but we want to put that information on the screen for the community to be aware. But I know that even if it's your neighbor, your family, your friend, somebody that you know that they're not savvy with these types of devices, taking the time to go over there and help them, I think, is what's really important. I mean, that's what a community does, and for those individuals that we know would have some very adverse effects if they did get infected with COVID, getting them vaccinated, I think, is important. Of course, the vaccine that's still a choice people have to make, right? I think this is a conversation we've seen nationally, and maybe somebody can speak to that, Dr. Underwood, just in regards to there's vaccines are controversial in certain ways. I mean, I can tell you, I don't get the flu vaccine every year, so I understand. But what are you seeing here at the hospital?
So we're seeing quite a turnout to get the vaccination. Now, there's different pockets even at the hospital of folks that are getting it, but I would say that the physicians, for sure, who are probably the most knowledgeable about the vaccine and how it works and the immune response to it, we're well over 80% of the physicians are already vaccinated. As we were talking before, 100% of our eligible emergency physicians have already gotten the vaccine. So, they're kind of leading the way and leading by example and not being coerced into it. They're just doing it because they know the benefit.
Well, and the hospital hasn't made any type of policy that said that it's mandatory, which
Not at all.
I certainly understand that point of view. I think nationally we're seeing it's 50%, which that's early on still. But there is another type of vaccine coming out, right?
Right. So the vaccines that are out right now, the Moderna and the Pfizer, the mRNA vaccines, and I know there's been a lot of discussion about that. The newer ones that are coming out, Johnson & Johnson is probably the most well-known, is developed in more of a traditional way that a vaccine would be developed, and that's where the antigen, which is what your body responds to, is essentially programmed into a different kind of virus that's attenuated, typically an adenovirus, which is the kind of virus that gives you a common cold. And then it's inoculated into the person, their immune response does what it's supposed to do and starts to react against that particular antigen, so that if you're exposed to it again in the future, your immune system responds before it can start having a significant clinical effect.
The ones right now are different than that.
They're
2 doses. The Johnson & Johnson is supposed to be a single dose.
That's correct.
And any idea of the timeline they're looking at for that?
I don't know the
Okay.
timeline on that one yet. Certainly, I think that they're starting to look at EUA on that, but I'm not sure when it'll be released.
Okay.
So, if people want to have the more traditional.
Well, it's good. We're in 1B now. We know teachers are in 1B and other critical frontline workers. And I do want to make sure that I mention Dr. Underwood to you and your staff. Thank you for all the hard work that you have done, and everybody who's been involved in this. I know in conversations here recently, I don't think I can put in my mind really what those individuals in the ICU units are seeing on a daily basis. And so please pass on my thanks to them for what they're doing.
I'll do that, Mayor.
But I think the overall point of this, Chief Burke, was we need people to get registered. We need immunity. It comes in different forms, but certainly the vaccine provides that key to the door that gets kids back in school, that gets businesses back open. Our restaurant industry has been decimated. The hospitality industry has been decimated. We need, for crying out loud, if this green, red, yellow program, if you own a bowling alley, you're never going to get open, and even if you're green. So we need to get a bit better than green, and I think that's what the big push is. What are some things you would say to the community, just from your point of view and being so involved from the very beginnings?
The COVID safe practices that have been pushed from the beginning are really integral in preventing that spread. Within the city, it's shown that just maintaining the social distancing, wearing masks, proper hand hygiene, keeping the areas clean, things like that are integral in that red to green transition. The vaccine on top of that is another tool in the toolbox, and will definitely play out in the end to help with that transition. So between maintaining the COVID safe practices, we are not out of the shed. The numbers continue to go up and are continuing to be concerning, and have potential of disrupting services and disrupting us even more in our daily activities. So it's integral that people maintain those COVID safe practices and get registered for the vaccine. And when we transition in, that they'll be automatically into the system to be eligible for that vaccine once their category is met. So pre-registering, maintaining the COVID safe practices, and watching out for not only yourself but your family and your community will help us transition into more of a green and beyond status.
Sure. Well, it's going to be with us for a long time, right? I mean, this is not going to go away. We've said from the very beginning, we've got to find a way to work within the environment where that exists. There's cold viruses, there's flu viruses. there's COVID viruses. So we have to learn to live with that and take the necessary precautions to ensure that it doesn't impact negatively the health of individuals that we love and we care for, including ourselves. Allie, from your department, you've been the central communication component of the county-wide force behind battling with this pandemic, and we appreciate all the work that you and Mike Mestis, who's the manager of the Office of Emergency Management, have done. Is there anything you want to make sure you press upon the public?
So yes, definitely like like Burke said, continue with your COVID safe practices and definitely register. Mr. Mayor, I did want to press on the fact that once you're be given your appointment, let's say that you are in an area where you don't have service and you for some reason miss your allotted appointment, don't panic. You definitely just go back into the system and then they re-notify you once an additional vaccine comes available. So for some reason you miss that email or you miss that notification in order to get your vaccine, don't stress. You're still in the system. You still will get a vaccine. Also keep in mind that they're going to give notifications to more people than what they have doses for that reason, in the event that someone misses it or something like that, so that way we are not wasting doses, because that is a big component that these doses are, and I'm sure the doctor can speak on that, they're only available and only good for a certain period of time. So we don't want to notify 15 folks and we only get 10 and then we've wasted 5 vaccines.
Sure.
So if for some reason you don't get in at the appointment that you were first given, don't panic. There's plenty of appointments. We're going to get you in. We're going to get you vaccinated.
I think that's a really good point, too. Just for folks that may have been registered for a while now, there's some that you put all your information in there and the system is then choosing which 1A, 1B, 1C that you get put into. And so you may not hear back right away. Again, San Juan County has gotten 3,000 doses.
A little, probably closer to 5, but
Okay.
yes.
So, keep that in mind. There's 120,000+ people in San Juan County. The Navajo Nation has gotten, an allocation as well. But, they'll make sure that you're on that list. And when it's your turn, you'll get that email, that phone call. And I've heard great things about the state's rollout. So that's good to hear. It's been a tough year, and it's good to have a win and something you'd be proud of that, hey, we're moving in the right direction right now. So, and I feel confident with the individuals that I'm working with that you all feel that way as well. So, great points. Dr. Underwood, anything you want to make sure we close with here?
No, I just want to reiterate kind of what other folks have said. The COVID safe practices still have to happen. Hand washing, wearing a mask. Our goal is to get back up and operational, and as many of these things, getting vaccinations, getting registered for the vaccinations, continuing COVID safe practices, all of those are going to get us to that point sooner. So continue to do those things that we know already work.
Well, we appreciate the sacrifice of the public. There's a lot of habits that have been changed. It's been just an interesting year from many perspectives. And I got to say, there was an article in the paper the other day, and Dr. Penny Hill noted that there's been 0 flu diagnoses at San Juan Regional Medical Center. And I think that's the only thing I can think of is that wearing the mask and washing your hands is why that is. But that's still it's crazy to me. That's just an alien idea.
Right.
So clearly people are doing the right things. This virus is much more contagious than flu, apparently. That's just my point of view, but I'm no scientist. Well, we appreciate you tuning in here to the mayor's table. The important components here is to make sure you get registered. If you want the vaccine, make sure you're patient and waiting for your phone call to go in. Know what's going on by paying attention to the State Department of Health website. And if there's individuals in your lives, whether they're social media friends, they're your neighbor, they're your family, please take the time to reach out to them to ensure that they know how to get registered, because we want to make sure folks who are in those categories that would be adversely affected by the virus get in there as soon as possible. So, well, thank you all for joining me today. I appreciate your time, and I'm sure we'll have you all back on again at some point here on the mayor's table. Stay true to yourself, take care of yourself, and make each day matter. We are a community that cares. Let's show that as we begin this 2021 year.